Sure. So thank you everyone for calling in. I know an email was sent out this morning that, due to the really cold weather, if people need to, if they have priorities with going out and seeing where people are and making sure people are safe, we understand to jump off, and that this is going to be recorded. So, if you need to leave early or jump off now, it can be watched in the future. So I just wanted to say that and thank everyone again for all of the hard work they do, and especially, days like today and the 102-degree weather we have sometimes in July and August really, puts in perspective how important your work is to making sure people are safe. So I want to thank you again all for that. The path monitoring training we're going to do today is to really look at we did a path monitoring last year. It was the first sort of baseline monitoring after the reconfiguration of the path grants to fit within the CAN system. And so there were a lot of lessons learned, we really want to keep the homeless outreach work in the CAN-wide system and really making sure it's fitting in. And so, some of the things that are going to be looked at this year are based on feedback and things that were found in the last monitoring. And everyone might not be fully implementing or have implemented all of the suggestions and recommendations, but that this is, again, we're going to look at it with a new lens and a new perspective. And also, if there are things that don't pertain to your agency, not everything will, it would be helpful to let me know beforehand, let us know beforehand what things you don't think meet your agency's contracts or obligations, and then we can figure out how to waive that. So I again want to thank everyone for being on the call today. Thank you for your participation in the path monitoring. It is a requirement of the SAMHSA funding that we monitor the path programs annually. I know it can be cumbersome and tough on the staff sometimes, but it is a requirement from SAMHSA. So with that, I'm going to hand it over to Lauren to start the presentation on the new monitoring.
Hey everybody, thanks for joining us. This is Lauren Peretti with Housing Innovations, and I'm joined this morning by Shannon, who's new to the HI team, and I think most of you haven't had the opportunity to meet her yet, but she will be coming out with me on at least some of the path monitoring visits, so you guys will have a chance to meet her. So before we get started, I just wanted to do a couple of quick housekeeping things. So just another reminder, apologies for those who came on early and have heard me say this multiple times now. But if you are, it works better, the sound quality will work better if you try calling in on your phone rather than using the sound through your computer. We are going to try, everyone is muted because we don't want people having to listen to that annoying whining sound. There does tend to be some feedback sometimes on this when we do these, if people are trying to use the sound through their computer. So you're going to be muted for now. We are going to try to open it up to unmute everyone periodically for questions, but if we get that feedback, we're going to mute you back, and we'll ask that people use the chat box to ask questions. And Shannon's going to be monitoring that chat box and responding as much as she can to questions as they come in. Reading questions aloud if we're not able to unmute folks, so that people can ask your questions directly yourself. And just know that if we don't get to everything today, we're scheduled by 11:30. We'll definitely finish by 11:30. If we don't get to all of your questions today, we will respond to any that we didn't get to in writing and post those along with the recording that we're going to post. And of course, as is always the case, you can always call us. So if you have questions that you didn't get answered today, just feel free to give me a ring, and I'll be sure to get back to you. So let me try to think if there's anything else that I missed. Oh, I know. So also, Shannon and I are both still pretty new to using this Zoom thing for webinars, so we appreciate your patience. We're probably going to mess up at least once. So, okay, go ahead, Shannon, you can start.
Okay.
First slide.
There you go.
Come on in.
All right, so this is our agenda for today. We're going to start by just going through, I've been out now to all of your projects at least once, and so we're going to share some of the common findings that we've had during monitoring. And we're going to, talk a little bit about monitoring and what the point of monitoring is, and about what you can expect when we come out to visit your projects in 2019. For most of you, 2019 monitoring is going to look very similar to what we did for a couple of you in 2017, and then the rest of you in 2018. So there are not going to be a lot of changes. We are going to be piloting a new remote monitoring protocol this year. So 3 projects will be monitored remotely, and we'll talk more about that. And we'll spend most of today really going through the changes to the monitoring guide. All of you guys have been monitored already. Most of the guide is the same, so we're not going to go through everything on the guide. We would be here for a long time if we did that. So we're really just going to focus on the things that are new. So, and I just wanted to say, we totally get that, right? I think we released the guide maybe a month or 2 months ago, and that there's new stuff in there, right? So obviously you guys are not going to have implemented all of that stuff by the time we come out and visit your programs in 2019. And, we understand that, and Alice understands that, and we'll be sure that where there are things that we're noting in the report that are related to new requirements, that we also note that, because some of the stuff will take a while for you guys to get put into place. And so we want to make sure that we acknowledge that. All right, Shannon, go ahead, next slide. So we also just wanted to start by saying, and this picture really represents it, that we get that these projects are a balancing act and a juggling act, right? So, I think many of you know, I used to work at a direct service agency. We had a big outreach program. We actually played a coordinating role for outreach for all the teams that were working in Manhattan. And, it's always the case, I feel like, with most services, but particularly with outreach, where the demands are enormous, the need of the clients is enormous, and the resources are limited. And in Connecticut, you guys also have, these humongous geographic coverage areas, right? So the geographies of each can are giant, and there's been a lot of change, right? So, Alice mentioned the recent reorganization of the contracts. Monitoring is still very new for you guys, right? The whole monitoring initiative, most of you got monitored for the first time last year. And we added, and we've, the guide is a work in progress. So every year the guide changes a little bit. And so given all of that, right, we get that it's entirely, not only possible, but likely that not everything that's in the guide makes sense for every program. And we'll talk specifically about places where we know some of the things just aren't relevant for certain programs. And also given, as Alice said, right, your contracts and your resources that you have available, not, even if it might make sense, not everything might be doable for your program. And so if that's the case, as Alice said, please talk to her. And, talk about, what the priorities are and what really makes sense. And then as long as, Demas is on the same page, we'll make sure that those things don't end up being findings in the report. Okay, next slide, Shannon. So, given how tough we know this work is, our goal is to really support you guys to do the best possible work that we can all do together, and to really make sure that in each can, there's a coordinated approach to outreach that is effective, right? It's effective at getting people off the streets as quickly as possible, at really prioritizing the people who are most vulnerable and the people who've been out there the longest. And of course, particularly we're reminded on a day like today, like living on the streets can be deadly for people, right? There's huge risks that people face, particularly in this weather, but really day in and day out. And that, you know, a critical part of your job and of our job is helping to, you know, create a model, a system that, that not only gets people housed, but recognizes that there are people who are, you know, gonna unfortunately stay on the street, even if we have housing available for them sometimes, and helping those folks to reduce their risks. And because the resources are so scarce, trying to do all of that as efficiently as possible. So I promise, I know it doesn't always feel this way all the time for some of you, but our goal is not to come out and just be a pain in your butt, right? That is not the goal of monitoring. The goal of monitoring really is to, you know, build a model together that's successful at achieving all of these things. And there really isn't good guidance available nationally about what the most effective, you know, outreach model looks like. And so we're really sort of working with you guys to build this plane as we fly it, and to come up with what we think, you know, the standards should be. What is a really effective, well-coordinated outreach approach look like? And so we're going to continue to make changes to the guide as we go, and we invite you guys to give us all your, you know, all your great ideas and your feedback as we do that. So, because the goal really at the end of the day is to learn together what works. And, you know, we know that, that unsheltered homelessness is this super stubborn, very complicated problem. And we know that because we go out and we see all of the great work you guys are doing. And I'll tell you that, that going out and being able to do outreach with your teams has been one of my favorite things that I've gotten to do in this job. Your teams are really incredible, and they're doing incredible work. And yet, despite that, we see that the point in time count for unsheltered homelessness, you know, really when you look at it between 2011 and 2018 across the state, it's really hovered pretty consistently between about 500 and 600 people. So there hasn't been a steady trend either up or down. So, you know, some years it goes up, some years it goes down, then it goes back up, right? And that's not unlike most other COCs nationally, right? Most COCs nationally are similarly not reporting a consistent trend either up or down in unsheltered homelessness. And that's because it's a really hard, really complicated problem to solve. And so, you know, and the things that we think, right, like, so we think, okay, well, obviously, if we had enough affordable housing for everyone, or, you know, even if we had enough shelter for everyone, that we'd, you know, that would solve unsheltered homelessness, right? But you guys know that that's not the case, right? Because, you know, you see it, right? You could have a housing unit for somebody, you could have a shelter bed certainly for somebody, and it doesn't mean they're going to come off the street. And that's sort of consistent with what, you know, with what, and there's really been very little research on, you know, really very little analysis on what drives unsheltered homelessness and what, you know, what is proven to work for unsheltered homelessness nationally. But we do know from some of the analysis that's been done that low availability of units that are affordable, even to very poor people, does not necessarily track with the rate of unsheltered homelessness. And similarly, shelter availability doesn't necessarily track with the rate of unsheltered homelessness, right? So most COCs that have recently reported decreases in unsheltered homelessness have also reported decreases in their, you know, in their shelter and transitional housing beds. So, you know, that really suggests, which I think is consistent certainly with the experience of the agency that I worked in doing unsheltered homelessness, and I think with your experience as well, that housing and shelter availability are really just one piece of this very complicated puzzle. So again, so that's our goal, is to really kind of figure this out together, you know, create a model that works, and then have these standards across the state that really encourage folks to adopt that model. All right, so I'm just going to go through what some of the common findings are, and then we'll talk a little bit about what to expect, and then I'm going to open it up before we get into some of the changes for the guide to any questions that you guys have. So I said this already, I mean, the most common finding that we had in all of these visits are that your teams are phenomenal, right? They really, it was so evident to us when we were out there doing outreach that they cared deeply, deeply about this work. And that they've got, you know, I was really felt very privileged to be able to see the connections that they have with people, right? When we didn't always run into people when we were out doing outreach, but when we did, your teams have very, care deeply about the clients, and the clients also feel very cared for by your teams. And that, these are folks obviously that don't have a lot of those connections. And so, your outreach teams are really, particularly on a day like today, literally a lifeline for people. So, and we just saw so much creativity, right? Like, I would say, across the board, your folks are not giving up on people, right? They are trying again and again, day after day after day, despite being, turned away often by people who are reluctant to accept help. They're trying over and over to be creative and find out what's gonna work for each person. So, okay, next slide, Shannon. So, and one of the things that we find every time we start a new monitoring program, not just the past monitoring program, is that, the requirements of the funders are often complicated. We know that, the federal requirements are, they're often very unclear. They make it very hard for people to find what the requirements are. And so that's really part of what our job is to help clarify what the funder requirements are and to make them transparent to you guys. So when we came out, no surprise, right? You guys didn't always know what the requirements were. And so of course you can't, you can't meet the requirements if you don't understand what they are. And so that's part of the goal of monitoring. So related to that, we definitely found that some projects are not consistently serving primarily unsheltered people, and that is really the focus, DEMIS's focus for this money, really focused on helping identify and get unsheltered people off the streets. Now, there are definitely different dynamics in different CANs, right, and within different areas within CANs, right, so not every area has a lot of unsheltered people or any unsheltered people in many areas. And in some CANs, I think those dynamics are very weather dependent. So there might be a lot of unsheltered people in the summer, but not so much in the winter. And so the primary focus should be on unsheltered people where they exist, and on making sure that you've got a strategy to ensure that that none exists, right? So that you're doing some sort of outreach regularly to determine that there's nobody out there and helping the people that are, obviously. The other piece around eligibility that we found is that projects were not necessarily only enrolling people who had either a serious mental illness or a co-occurring serious mental illness and substance use disorder. Again, because this is outreach, right? People are not going to come with a tattoo on their arm with their diagnosis on it, right? You're not going to necessarily know whether or not somebody has a serious mental illness. So the criteria is that if you suspect somebody has a serious mental illness, then enroll them and work to get that disability documentation, which we understand. We had people when, in New York that it took years before we could get an actual diagnosis, and we get that. But as long as you suspect it, enroll them, but just don't enroll people that there's no reason to suspect that they're not seriously mentally ill. So the other thing is that we definitely saw the level to which what is actually happening on the ground is or is not aligned with what was written in the intended use plan. There's a lot of variation there across programs. And again, I think sometimes those IUPs might be a little outdated. So you definitely want to make sure that you're updating those every year. And then even if you did update them, by the time we come out and monitor, circumstances on the ground may have changed. So what you wrote in the IUP may no longer make sense, and we get that. So on that issue, I think if what you wrote in your IUP doesn't make sense anymore, just talk to Alice and come to an agreement about what the change is, and that's what we would look for if what you're doing diverges from the IUP, that was agreed upon between you and DEMIS, is what we would look for in monitoring. And then the other thing that we see is a lot of variation in terms of documentation, right? There are a couple programs that we saw that are really doing a lot of documentation, right? Almost to the level that you would see in a PSH program. And then there are some programs that had almost no documentation, right? Where there were certain charts that there was no documentation really for particular charts that we selected. And so the expectation is not that you're going to have the same level of documentation for an outreach program that you would for a PSH program, for sure. But we do need to see enough documentation to demonstrate that you're meeting the requirements. And more importantly, enough documentation that if something were to happen to your outreach worker unexpectedly, that someone else would be able to pick up and know what work had happened and what work needed to happen with the clients that you're serving. And so basically, what we look for in terms of documentation is a super brief needs assessment. It doesn't have to be like the CSH, PSH need assessment that's 20 pages long or whatever it is. It can be something very brief. We are going to be working with DEMIS. I know some folks have already developed that. We'll look at what's been developed already, and then we're going to be working with DEMIS to develop something that you can use if you don't already have something. So a brief assessment that's updated every 6 months, a service plan that's updated every 6 months.
Hello.
That if somebody else were to have to pick up the case, they'd be able to know where to find people. There's some new requirements coming out of the progressive engagement work group around how how encounters are documented, and we'll talk more about that. And then we also look for monthly contact attempts post-discharge for 3 months. There's an expectation that you're following up with people at least monthly for 3 months post-discharge, and that needs to be documented. Okay, next slide, Shannon.
Hello.
Hi. So someone seems like is having trouble with the line. So okay, so we said this already, right? In some cases, staffing levels might not be sufficient to do everything that's in the guide. So talk to Alice if you feel like that's the case for your program. One concern we had when we went out with some programs is that there are some outreach workers that are exclusively doing outreach alone. There are some programs that always have folks doing outreach in pairs, and then there are some places where there's only one outreach worker in the area, and so that person is always doing outreach alone. And in some cases, outreach alone is probably fine, right? Like if you're outreaching to the library or a shelter or the public square, right? Like outreach alone is probably fine. But there's some cases in which we're very concerned about worker safety when they're doing outreach alone, right? So if somebody's going to an encampment, or they're going to a remote area, or, they're doing outreach at night, or, early in the morning before it gets light out, or, to someone that they don't know, or to somebody that has a history of being volatile, right? Those are situations in which we would want there to be outreach in pairs. And so the hope is that, and what's included in the guide is that you're working with other folks in the CAN. If there is only one outreach worker in the area, that there's a strategy that you're working with other folks either at your agency or within the CAN to make sure that when those situations arise, that there's a way for your outreach worker to get a buddy to do outreach with. And then also similarly on the safety issue, we did see sometimes projects where there was not a system, a standing policy for making sure that someone back at the office always knows where the outreach worker or workers are. And again, that's not like because, we want to be big brother monitoring where people are all day, but it's really for safety, right? So that someone always knows where folks are and when they're expected back or when they're expected to call in, so that there's periodic check-ins so that we can make sure our outreach workers are okay. And then also similarly, we did not consistently see that there are, sort of like a written plan for a schedule for an outreach plan, and we're going to go into that in detail. I'm not going to talk about it now. and we did not consistently see, we rarely actually saw placements, housing placements being tracked. So like to know, okay, last year we did 10 housing placements and this year we only did 5, or this year we did 15, setting some sort of housing placement targets and using that information for, to help keep making the program stronger and stronger. And so we have promised to develop a tool that you guys can do that. And I know we said this before, but I promise we will get that done in 2019. And then also we're not consistently seeing supervision happening, and we'll talk more about that in a minute. And then lastly, the last point on this slide, I think I started working in Connecticut, I think, maybe 20 years ago. And when I think about what the system, and I use system loosely, then looked like, it wasn't so much of a system, right? We were a bunch of siloed, not just in Connecticut, all over the country, right? We were a bunch of siloed programs. And compared to now, like we obviously have a much more coordinated, systematized approach now, but I think as long as we all live, there will always be opportunities to continue to strengthen that coordination. Okay, I'm gonna pause now and open it up. Shannon, do you wanna unmute everybody to see if we've got questions? And if that doesn't work, we'll try the chat feature.
Okay, unmuting.
You are unmuted.
Okay, that's not gonna work. That's what I suspected. Are there questions that have already been asked? Oh, okay. Anybody have any questions they want to? We're gonna get to the changes in the guide in a minute, but I just wanted to open up if anybody had any questions they wanted to ask now.
I mute.
Are there things that have come up in the chat box that we might want to?
But please, if anyone has anything, you can put in the chat box also.
All right, so I'm going to keep going then. So basically, you can switch to the next slide, Shannon.
Oh, no, I lost her. I'm looking for you, Lauren. Lauren, are you there?
There we go. Thanks for your patience, guys. Yep, I'm here. When she mutes everyone, she then has to unmute me. So, okay, we won't try that again. So in terms of what to expect this year, so basically most of the projects are going to be, we're going to come out and do on-site monitoring. As Alice said earlier, I'll say it again in case people didn't get on right on time. SAMHSA requires that DEMIS monitor programs every year. So we're sorry about that, but that is a requirement that, there's nothing we can do about it. It's the federal requirement. So, so we are going to try and find ways to, to make monitoring less burdensome for you guys. And so one of the things that we're going to try this year is we're going to pilot some remote monitoring, and we'll talk about that in a minute. So 3 projects will get monitored remotely, and we'll see how that works. But for the rest of you, we're going to come out again. And it's going to be very similar to what we did before. So we'll send you, a letter. It'll, have a list of everything we want you to send us in advance. You don't have to send things that you already sent, right? So if last year you sent a non-discrimination policy and we said that non-discrimination policy looked good, right? There was no finding related to that non-discrimination policy, then you don't have to send me that same non-discrimination policy again, right? So when it comes to the things we ask for in advance, obviously there's some things you need to send in again every year, like your client list, right? But in terms of policies, only send me something that's new. So one thing that I suggest is that when you get that notification, look at your final report from last year, see where there were findings related to policies, and only send me a new policy if you've made a change to address that finding. If we don't get something new, we'll assume the finding still stands, right? If there was a finding on conflict of interest and you didn't send me a new conflict of interest policy, then we'll carry that conflict of interest policy forward. But if you corrected that, then send me your new policy, all right? There are a couple new things in the guide that that we'll ask you, that we'll need you to send. Everyone will need to send because it's new in the guide. So there's some new training requirements in there. So we need relevant training records. It doesn't necessarily have to be certificates, right? You don't have to show me the actual certificate from the training that you attended. If you keep some sort of log or other, system for keeping track of what training your folks are attending, that's fine. There's some new requirements around the outreach plan, which we'll go through. So you'll need to send me that. If you had it, again, you might not have it. Totally understandable. If you don't have it, it's a brand new requirement. And then the same thing, right? We'll meet with you at the beginning. We'll meet with you at the end of the day. We'll go over at the end of the day what we think the findings are going to be, so that there are no surprises, and most importantly, so that you guys can tell us what we got wrong, right? What we missed. There's a ton of stuff that we're looking at and we missed things. So that's your opportunity to say, hey, this service plan that you said wasn't there, here it is. That won't change. We'll get to go out and do outreach again with your teams, which is great. That's something I'm disappointed about in doing remote monitoring. We won't be able to do that, but when we come on site, we'll continue to do that. And we will, while we're out, with the way we handle the interviews, which we use loosely, right, is we really do that while we're out with the teams. So we talk with clients if we can while we're out, and we do a lot of talking with your staff while we're out. We usually don't have to actually meet again when we get back in the office. We get most of what we need while we're out with them. And then, as before, we'll write a report. You guys will have a chance to look at the draft. We'll make any changes that are required. We'll issue the final report, and when you get the final up report, we'll give you the template for the follow-up plan. Okay, next slide, Shannon. So new in 2019 is remote monitoring. So instead of coming out to your site, Shannon and I will look at some of your materials. We'll tell you what materials we want to look at in advance, and we'll look at them from home. We both work from home. And just in case you were wondering, we both work in Pennsylvania, and where we work looks nothing like this. So this is not the view that we will have while we're doing remote monitoring. I'm looking out my window right now, and it looks nothing like this. And basically there'd be a couple of different ways that you can submit those documents to us. And what we'll be focused on, if you're one of the 3 programs that's going to be monitored remotely, is really the findings. So if there were any findings from last year, looking at the extent to which you were able to correct those findings. And then we'll look just at the new things, right? So we'll send you a list of what we need in terms of client records in advance. And we promise we'll only ask for the least amount of stuff we need in order to do our job. We'll try not to burden you with a huge request. And then you'll have a couple of different options for how you give us access to those records. So the first one, which may be easiest if it works for you, would be to give Shannon and I time-limited remote access. If most of you have an electronic record system that you're using, and we'll sign whatever documents you need us to sign in order to enable time-limited remote access to those documents. That might not be possible because your agency might have a policy that you can only access those things in the office from an agency-owned computer. So if that's the case, or you aren't using the electronic record system, then there are 2 other options that we came up with. One would be that you would have to redact confidential information, which is going to be a pain, so you might not want to pick that option, and then submit that information without any confidential information on it. You'd have to make sure that there was the HMIS ID or some way that we could identify which client the materials belong to. And then probably easier than that would be we can make arrangements through CCEH to get access into HMIS, to the client records in HMIS. And so you can upload unredacted documents into the client's HMIS records, and we can see it that way. These are just the ideas that we had. So if you guys have other ideas for ways that you think we can make this easier for you, please, by all means, let us know. We're open to whatever works best for you guys. Okay, I'll do one more slide, and then we'll see if there's questions again. So this is just, this should look familiar to you guys. This is the report key, so this has not changed. Basically, if there are findings from the monitoring, anything that's pink, those are the things that DEMIS considers to be significant findings. For those things, they'll ask you to do a follow-up plan. Anything that's highlighted in yellow, you should correct it, but you don't have to tell us your plan for how you're going to correct it. And then there are a lot more things in the guide this year that are best practice recommendations, and those will be highlighted in green, and it's up to you what whether or not you want to implement those things. Okay, do we have questions in the chat box, Shannon, that we should break
Yeah, there was a question when you were talking about documentation. Would you want us to take the calendar year or PDX reporting year? So there's one requirement for training records the last 12 months. I don't know.
Yeah, it doesn't matter to us, honestly. We just ask for the last 12 months. And if you, let's say you have a system where you collect that information based on fiscal year, right, then send me the fiscal year. We try to do this in whatever way is easiest for you guys, right? So if you collect that information based on calendar year, then send me the calendar year. If you collect it based on fiscal year, then send me the fiscal year. If, you don't have any system for collecting it, then just send me for the last 12 months from the date, calculating from the date we send the notification, for example. And the same thing is true for the client list, right? Whatever way is easiest for you to generate that report works for us. We ask if it's doable for you to send us the most recent 12 months. That's our preference for the client list. Okay, but if it's not doable for you, then we can talk about what works better for you. Other questions?
None in the chat box.
All right, so go ahead to the next slide. So now we're going to go through the changes, the new things in the guide. So the first one, I mentioned this earlier, is there's always been in the guide a requirement that outreach workers are getting individual supervision, at least biweekly, so that didn't change. There's just some new guidance around supervision in the guide. So, again, we know that this work is super complicated, it's super hard. I worked at a direct service agency for many, many years, and I know that when we are busy, often the first thing that gets pushed aside, when a program's under-resourced, is supervision. And, we also know, though, that the busier staff are, in some ways, the more important supervision is, because it helps to make sure that we're on the same page about what the priorities are, and that staff know what those priorities are and are focused on those priorities. Similarly, we know that the clinical profiles of the people that you're working with are very, very complicated, right? So both medically and psychiatrically, right? You've got people who are actively psychotic, you've got people who are actively using substances, you've got people with all sorts of, medical needs. And, almost everyone, I don't know, maybe everyone that you work with has significant trauma histories, right? So if they weren't traumatized already before they got on the streets, they probably have been traumatized since they've been on the streets. And so, and then on top of that, most of them have been burned many times in their life, either by, people in their personal lives or, many of them by the social service delivery system. And so it's very hard for folks to trust and engage. And so figuring all of that out is extremely complicated, and figuring out what's the best approach for each person to try and get somebody who's reluctant to engage, really requires some clinical sophistication. And we know that in a lot of cases, the outreach staff are not clinicians. I think almost every case, they're not clinicians. So, there's a new requirement in the guide that there be some provision in place to be able to provide outreach staff either with clinical supervision or clinical consultation if clinical supervision is not something that is doable at your agency. And both of those things can happen either at your agency or through a partnership. And again, if it's just simply not doable for you, talk to Alice about whether or not it can be waived. So, okay, next slide. So another thing that we've seen pretty consistently is that there's not necessarily a way within the CAN for, if I'm just, random neighbor that lives in your CAN and I come across somebody that's unsheltered and I'm worried about that person, there's not necessarily a way that I would know who to call. And in some cases, maybe I would know that I should call 311, but there wasn't necessarily always consistently a system in place for 311 to be able to make that referral promptly to an outreach team in order. It wasn't clear that 311 sort of saw that maybe as part of their job, or that there was really a system within the CAN for doing that. And maybe the system isn't 311 in your CAN. But that's a new area in the guide, so making sure that there's some system for people to know how to report concerns, and that there's some system for then, responding to those concerns as much as warranted and as possible. So we talked about this a little already. The requirement in the guide is that there's some system to be able to track client locations. That's not new. Again, so if your outreach worker disappeared tomorrow, you'd have some way of finding people. So that part's not new. The new part is there's a best practice recommendation around leveraging technology to be able to do that. So we know that you guys are already leveraging technology when you do the PIC count, to keep track through geocoding of where people are being found. Looking at whether or not that technology or other mapping technology that your agency might have could be helpful. And again, this is a best practice recommendation. My guess is that none of the agencies are going to be doing this in 2019. And we are currently talking with CCEH about how HMIS might be helpful in this regard, and we will keep you posted as more information becomes available. Hopefully over time, we will figure out together how to better leverage technology for this purpose. Okay, next slide. So I'm not going to, let me just see, I'm not going to go through all of this, right? So this is really some additional detail that we put in the guide based upon what we saw actually happening, with your teams. And so for the most part, your teams are great at this. They're definitely focused on engagement and know how to do that, and are working to make sure that services are flexible and are maximizing client choice. I won't go through all this. You guys can read it. Let's move on to the next slide. So the next slide, actually, do we have questions, Shannon, before I keep going?
No, nothing new.
Okay. The next slide, so this whole area in the guide is new. So again, this is a place where we wouldn't necessarily expect that you have this in place when we come out in 2019. But so the goal here is to work towards having a written plan that does all of these things, and that is, developed with input from your CAN. So the first thing is making sure that there is a plan for identifying what are the highest priority areas, right, where there's the highest concentration of unsheltered people in the CAN. And, those are the areas, obviously, that you're going to canvass. How frequently are you going to canvass them, right? If there's more than one outreach provider in the CAN, right, who's going to canvass when, so that you're not kind of duplicating effort and covering some areas twice and not covering other areas at all. When does it make sense to canvass, right? So in some areas, are you going to canvass early in the morning because that's when you're most likely to find people? Is it, certain areas you're going to go in the evening because that's when you're most likely to find people? And then there are going to be these large swaths of every CAN where canvassing makes no sense, right? Because you would walk around all day and you wouldn't find anyone. And so in those areas, really thinking about what's the strategy for identifying unsheltered homeless people and connecting with them. So in some areas, it might be you're going to call the librarian once a month. In some areas, it might be you're going to make regular contact with the police department or the church or all of the above, right? It really is going to be very specific to the dynamics within your individual camp. But the idea is to make sure that across the CAN, right, you're known as a resource and that you are identifying anybody that might be unsheltered and connecting with them. So the idea really is to have a written plan that looks at, I mean, obviously, right, like your resources are limited. So you have to look at what are the hours that you have available for outreach, right? What are the most important things that need to get done each month, and how are you going to strategically allocate the available hours to accomplish those things? And that includes, obviously, a focus on getting the people who are most vulnerable off the street. So you've got to figure out who those people are and how you're going to carve out time among all these other things that you've got to do to make sure that you don't lose focus on that critical thing. Okay, next slide, Shannon. And then a couple of other quick things that we'll look for eventually when you guys have time to get these plans together. So what's the coverage plan for when staff are out, right? So if staff are out on vacation for 2 weeks, right, who's checking in with the people who are most vulnerable? If somebody happens to be out on medical leave for a month, right, how are you going to make sure outreach continues to happen? And then also, and this is obviously relevant today, what are you going to do differently when there's a weather emergency, right? So how's the plan going to change if the temperature drops to 0 or goes up to 100 to help make sure that people, as much as possible, are safe and don't die, don't freeze to death on the streets. And then hopefully this is already in place in most places, but some system I know in a lot of places your teams are the ones that are doing the pick count, but there's also other folks in a lot of places that are doing the pick count. So how are you going to know if somebody really vulnerable, like a family with kids, was identified during the pick count, and make sure that you've got enough information and that information gets to you quickly so that you can do some follow-up and help them. And, obviously, this isn't going to be a stagnant thing, right? The plan is going to need to be nimble and change. The idea is that it's a framework, not a rigid structure, and that you change it when it makes sense to change it. And so what the guide suggests is that a supervisor, takes a quick look once a month and, tweaks things a bit, and that you're getting input, as I said in the beginning, from your CAN. Okay. Questions, Shannon, or are we still good?
What Leilani's asking what the pick count is.
Oh, okay. The pick count, the point in time count. So the thing that just happened where we go out and we canvass and count everyone once a year in January.
She apologizes. She's new.
No, that's fine. That's fine. And I should have said, it's my fault, Leilani. I should have said that in the beginning. I thank you. When I use acronyms, I always invite people to please tell me if I'm using an acronym that you're not familiar with. That's my fault. So, okay. Next slide, Shannon. Were there other questions?
No other questions right now.
Okay. So, the guide encompasses a whole bunch of different aspects of effective housing-focused case management. Most of this is not new. These are the things that you guys are doing every day to get people off the streets and into housing. If you want to flip to the next slide, Shannon, there are a couple of new things that we'll go over. The first one is housing navigation. And I think for the most part, this is already happening. It just wasn't in the guide. Making sure that everyone is assigned either a primary PATH worker, right? So if there's somebody who's eligible and they're going to be enrolled in your PATH program, that they're assigned, or they're assigned to another worker within the CAN, so that there's one person that's really responsible for doing housing navigation for each person. It doesn't necessarily have to always be you guys, and it can't be you guys if it's somebody that's not eligible. And then the next item is really a best practice. The next two items are really best practice items, and they're related. It's this whole idea of warm handoffs, right? So if you're making a referral to a community-based service provider, and you guys are already doing this, whenever possible, have the outreach staff accompany the client to that initial appointment to make it more likely that that relationship gets established and that the referral is a success and that the person actually ends up engaging in those services. And then the same thing at the back end, right? When you're discharging someone, if you're discharging them, for example, to permanent supportive housing, right? That your outreach worker who knows this person has been working with them for all this time and really has gained that person's trust is doing a warm handoff meeting with the housing case manager and the client to help bridge that transition and make it a successful transition. And again, we get that you do not have time necessarily to always do all of these things, and so these things really are best practice recommendations, not requirements. So, okay, next slide. So this slide really talks about the new items around community partnerships, and right, we know that unsheltered homelessness is in part, right, that what causes it is the convergence of like all of these systems failures, right? So if we had a better affordable housing system, a better healthcare system, a better foster care system, right, we wouldn't see so much unsheltered homelessness. And so we know that when the causes are multi-systemic, right, the solutions have to also be multi-systemic. And so the more that we can avoid working in silos and really, coordinate with our partners, the more successful we're going to be at ending unsheltered homelessness. And so the guide adds a couple of specific things related to that. And a lot of these things you guys are doing already. So the first one, making sure that someone is actively participating in the local CAN to make sure that unsheltered people are getting their due from the CAN and that they're being prioritized based upon their vulnerability, like people who are sheltered, and that their needs are represented there. A lot of these recommendations are coming out of the progressive engagement work group, and so I think specifically they're looking for for outreach staff to play that role. So outreach staff participate in CAN case conferencing and housing matching meetings. And again, right, if that does not make sense in your CAN and you guys have another way of, meeting that objective, then by all means, talk to Alice and see if it makes sense to waive that requirement for your CAN. Again, this is also coming out of the progressive engagement work group. So it's to make sure that you are, obviously everyone's doing the VIs for that, but the suggestion is to really be using either the mobile app, or if you're good doing it on paper, entering it into HMIS on the same day. And I think the thinking there is to just make sure that that information is getting into the system quickly, promptly, processed promptly, and that everyone has access to it right away. And Alice, jump in if I'm misrepresenting any of this stuff. And then lastly, and this I think is related to eligibility documentation. It's been hard to document eligibility for people who are unsheltered because the outreach encounters have not historically been in HMIS, but making sure that all your encounters are entered in HMIS so that we can make sure that people are found eligible for housing that should be eligible for housing. Okay. And then, we definitely heard a lot from you guys about, the utility or lack thereof sometimes, I think, for HMIS for your teams, like feeling that it's not as user-friendly as it needs to be, that it's not as useful for your teams as it needs to be. And we know that a lot of times that can lead to data quality problems. And obviously this data is only going to be useful if it's correct. So making sure that you've got some system for periodically taking a look at what you're entering in HMIS and doing some sort of quality review to try and make that data as accurate as it can be. And then this is a best practice recommendation, but I think is super important, right? That there's a process in Connecticut, which is through the HMIS steering committee, for continually looking at HMIS and making it more responsive to your needs. So we want to make sure that all of your ideas about how HMIS could be more responsive to your needs are fed to the correct body and that your voice is heard at that HMIS steering committee meeting. So making sure that you are feeding those suggestions to the right people. And if you don't know how to do that, feel free to reach out to me or to Alice, and we can put you in touch with the correct folks. Okay. So next slide. And I think we only have 2 more slides on changes, and then we're getting ready to wrap up here. So, so this is one of the places where this is not going to be relevant for every program because based upon the visits that we've done so far, every CAN I don't think has encampments. Some CANs have a lot of them, or not a lot of them, but some CANs have them consistently, and some CANs see them rarely, if ever. So if you're a CAN that doesn't have encampments, then this doesn't apply to you. And all of this stuff is best practice recommendations. And, you know, we definitely heard stories when we were out with your teams about the police just coming in willy-nilly and, you know, without notice to the folks that were living in the encampment, without any coordination with you all, you know, bulldozing an encampment, clearing it out and throwing away people's stuff. And we know that that approach to encampments is, you know, it damages trust, right? It pushes people more into the margins and makes it less likely that they're going to get the help that they need. And so the guide suggests a more collaborative community approach where all of the different stakeholders and who those stakeholders are going to vary from community to community, but are coordinating to try and make sure that, you know, that doesn't happen and that folks are engaged, you know, that there's a coordinated approach to figuring out what people need, you know, to thinking creatively about how to leverage all the different resources that exist to get people access to what they need. And that certainly if there's going to have to be a removal of an encampment, which we get sometimes is necessary, right? That there's a plan for how that's going to happen and a plan for notifying the residents of that timeline to try and help them to figure out how they're going to keep as much of their stuff as they possibly can. And of course, always to be responsive to the neighbors' concerns and to keep them informed about what's going on. Okay, next slide. So, and so this is also another place where this might not be relevant for you because you are, in fact, the only outreach provider in your CAN. But if you've got multiple outreach providers in your CAN, the guide suggests some best practices. So, talked about this a little earlier when we were talking about the outreach plan, right? Making sure that there's some coordination so that all of the high priority areas with the most likely concentrations of unsheltered people are canvassed regularly and without duplication, right? So that you're coordinating who's going to canvass where, when. I think some CANs are already doing this. In some cases, I think it's in New Haven, the teams are going out together, right? They have these kind of cross-agency teams that go out. Making sure when possible that how folks are getting assigned to a primary worker is leveraging agency strengths and not necessarily just based on who found the person, right? So if you've got somebody that's got acute medical needs and there's an agency that's got more nursing resources than another agency, that they get assigned to the agency with nursing resources. If you've got somebody that's got, you know, that's very actively psychotic, right? That person gets assigned to an agency that's got some resources and expertise in working with people with serious mental illness. Also, the guide suggests that all of the agencies that are doing outreach in the CAN convene at least monthly to case conference. So, you know, where you're all seeing the same people, you're sharing information with each other and strategizing together about how to most effectively move those people off the streets and into housing. And a lot of that's probably already happening through your CANs. And then also considering where you've got an agency that's really stuck with someone, whether or not a transfer to another agency at least is considered, whether or not that would make sense. All right, so I think that is all of the changes. You can switch to the next slide, Shannon. So Andrea, I think a lot of you know Andrea White on the Housing Innovations team. She and I are going to be doing a more in-depth, a full-day training on outreach for outreach workers, line staff, as well as supervisors. It's open to all outreach teams across the state, regardless of whether or not they're past funded, regardless of whether or not they're in CT Boss or in Fairfield County. And all the information about that training is here. And we ask that you register in advance so that we can be sure we have enough materials and coffee for everyone. And that link is here. I think it's, this one's already gone out. So you should have also gotten it by email. But if you didn't, let us know and we will get it to you. Next slide. All right, that's it. So are there any questions that people have? You can put them in the chat box. Sharon, do we have any questions in the chat box?
No, nothing new.
All right. I think the last slide is our contact information. So if you think of things after today, please feel free to email me. My email address is right here, Lauren Peretti, lperetti@housinginnovations.us. You can also call me. My number is 267-640-7001. So feel free. Shannon, you want to put that in the chat box so that people can get it?
Yeah. Yeah, and there is a question from Lizbeth. You sent, she asked to send the invite for the past training, so we can do that later.
Okay, great, yeah.
Yeah.
So thank you for your time today. We feel for you guys and your teams when you're out on the street in this incredibly cold weather. We especially feel for the homeless people who are out on these streets day after day in this incredibly cold weather. We thank you for all the amazing work that you are doing to end unsheltered homelessness and homelessness generally in Connecticut. And thanks for joining us. If there are questions, like we said, this whole thing, the recording of this is going to be posted. If you've got questions that you didn't get a chance to ask today, let us know, and we will see you at your program soon. Thanks, everybody.
Thanks, everybody.